Welcome to another episode of Heart to Heart. Wait, isn't that a different show? Hey guys, it's Dr. Babes, and this is The Good Doctor. Love is truly in the air, and so is the heart. Probably doing cardio, because Valentine's Day is the season of flowers, chocolates, and heart-shaped everything. Let's look into the heart of what truly matters. On today's episode, let's have a heart-to-heart talk about heart diseases. The heart keeps us alive, so having heart disease can be a very important factor in how long we live. According to CDC, the world's leading cause of death is heart disease, causing 1 in 4 deaths, claiming 1 life every 36 seconds in America alone. Add COVID-19 into the mix, and the urgency of heart health awareness amplifies, whether you or someone you love is at risk. For something so important, there's a surprising amount of misinformation about it. That is why everyone should familiarize themselves right now with this crucial and potentially life-saving information on just how heart disease is most often detected, how is it treated, and how those you love can avoid becoming another statistic. Heart disease is the catch-all term referring to any disease of the heart, and coronary artery disease, or CAD, is the most common type. CAD happens when plaque, a combination of fat, cholesterol, calcium, and other substances found in the blood, builds up in your arteries. In layman's term, your blood tubes are all gunked up. I have discussed this in more detail when I talked about cholesterol in our previous episodes. So over time, these plaques can lead to narrowing of arteries and increase your risk of a heart attack. A heart attack is when a part of the heart muscle dies because it is deprived of blood flow or oxygen. Or it can be due to the heart having to work really hard that it outstrips the oxygen supply. Despite common misconceptions, a guy grabbing his chest and falling to the ground is not the typical presentation of a heart attack.
Mr. Burns, I think he's dead.
Oh dear.
Yes, some people do experience the classic Hollywood heart attack, but the truth is, the symptoms of a heart attack can be much more subtle. Many heart attacks begin with only mild discomfort in the chest that intensifies over time. Other symptoms include pain in one or both arms, the neck, or the abdomen. Shortness of breath may accompany the pain, along with unexplained sweating. Time is critical in treating heart attack. The condition can be totally reversible if diagnosed and treated early. Irreversible damage begins within 30 minutes of blockage, and half of deaths occur in the first 4 hours after symptoms begin. Doctors can perform an angioplasty to reopen the artery. It is a procedure that opens up blocked blood vessels without surgery by inserting a catheter, and a stent is placed to keep the arteries open. It takes about between 30 minutes to 2 hours, depending on the number of blockages. Discharge from the hospital is usually 12 to 24 hours after the catheter is removed, and many patients are able to return to work within a week after the procedure. The top 5 risk factors for heart disease are high blood pressure. So, what's your blood pressure number? Are you a diabetic? What is your cholesterol? Obviously, no one should be smoking. And then there's your family history, where you may not be able to do anything about that. If a relative on your mom's side, like Uncle John, Aunt May, and Papa Joe, had a bad heart, you're more likely to have one too. Race is another factor. For instance, African Americans are at higher risk of heart disease for a variety of different reasons. And then there's gender. Men in general are at higher risk than women. But once we hit menopause, our risk is about the same. Yay! Equality! Obesity and lack of exercise also put you at risk for heart disease. Even stress is on the list. But the beautiful thing about heart disease, whether you have some of these unique risk factors, is that 90% of heart disease is completely preventable and controllable. Just eating well, exercising, and not smoking will take care of most of them. I know, figuring out what eating well means is confusing in itself, but it's basically pretty simple. Lots of fruits and vegetables, fish, lean proteins, and all simply prepared with limited sugars and healthy fats like olive oil. For fried foods, I'm sorry. Exercise can be similarly complicated. But again, let's simplify. Choose whatever exercise gets your heart pumping and that you can tolerate enough to do it for 5 days a week for at least 30 minutes a day. Just a little TMI since we're doing a heart-to-heart talk. 75% of millennials and Gen Xers think sex counts as exercise. And hey, if you can hit the 30 minutes, 5 days a week goal with sex alone, well, more power to you.
Yeah, boy.
The bottom line is, know your risk factors. If you're smoking, stop. If you're a couch potato, get off and start taking 10 or 20-minute walks every day. Physical activity is medicine. Know your cholesterol and blood pressure numbers and maintain a normal weight. These are all ways to help reduce your risk of developing heart disease. You can't wait until your 30s to start caring about what happens to your heart. By the time you realize it, it might be too late. So there is hope, and it's all about understanding your risk. Now you're equipped. Heart disease may be one of the world's top dangers, but you know which risk factors to address and how. Talk to your doctor about any specific concerns you have about heart health. Or you can just ask us through our free consultation. We'll be providing the link below. Thanks for checking out the Good Doctor YouTube channel. If you'd like to get more videos, subscribe to our channel and don't forget to visit our website and other platforms to stay informed. This has been your Good Doctor, and thank you for watching.